one thing is definitely that many of the very young children are coming to our side quite late. So meaning they had been seen at other institutions before that, but you know, sometimes I think it's also difficult. You know, if you see a child with acute infection like a bronchitis or something like that, or tonsillitis, then maybe a person who is not specialized on children is treating the acute infection. And like, for example, that example of Valerine who had taken out the tonsils. I think that's a typical case. You know, they're treating all the typical pediatric diseases or symptoms. Okay, it's a tonsillitis, so they take out the tonsils, and but they didn't follow it up, you know, because they thought, okay, it's a normal child's disease, and but sometimes they're not trying to get the underlying reasons. And
but this is an area with a high prevalence of HIV. Why don't doctors think to test for HIV when they see children not responding to treatment?
Yeah. I must say, honestly, I do not know, and I'm trying to find out the reasons for that, but I'm also wondering a lot why people are coming so late, or not the people are coming late, but the clinics, the doctors, the hospitals, they're not responding in the way, as you said, the prevalence is high. So if I have a child with recurrent infection, I think one of the first things I would do, I would test the child for HIV. But I definitely I can't tell you so far.
Is one of the issues money? Because I'm aware that in the Free State that the government no longer treats people with HIV because they have huge budgetary problems for treating this.
And that's one of the problems for sure. So they had a huge budget cut. So there was even a state when no new patient was initiated on ARVs. So I think it was almost since mid of the last year that there was no chance to get new patients on treatment in the Free State because of that budget cut. And as according to my information, it's also that they're still struggling also for this year to have enough money in their budget to put new patients on treatment. So I think that our numbers will be also growing at our side because of the need.
Are there other places around here that treat people with ARVs?
So the next one, the next town is a government site, which is located in Sasselburg. That's around about 55-60 kilometers away from here. So before we started here with our site, the people had to travel to Sasselburg. And many of them failed, of course, because actually to pay for a taxi to go 60 kilometers to Sasselburg, and especially in the initiation phase of ARVs, you have to come maybe to the site the first weeks 2 times a week or something like that. And I think that's also a reason why many people failed on the initiation of treatment.
And how about children? How does this affect children, this lack of budgeting for ARVs in this area?
I think it will definitely affect children more than adults because they have to use other medication than the normal routine regimen which you give adults, meaning that is also more expensive, the medication for children. And you need to have a much more variety. So because you have to adapt the medication to the body weight of the child. So you have to. It's not something a process which is stable once you initiated the treatment. Also with adults, of course, with side effects, maybe you have to change the medication, but it can go stable for quite a while. But children, you have to see more often, you have to adapt the medication more often. So I think the whole overall care what you have to give to a child on ARVs is much more time consuming and much more expensive in contrast to an adult.
How much, could you give me a figure about how much it would cost for a month of ARV treatment for a child at the age of 2, let's say?
Yeah, you know, for an adult you count about 350 to 400 rand a month. Maybe if he's getting another regimen which is a bit more expensive, you're coming up to 500 rand a month. But for the children you can sometimes put, I think, 30% off to that cost.
And what are the difficulties in children taking the medicines? You showed me earlier how a powder has to be mixed, and this generally has to be done here for families that don't have access to clean water. And then they have to take 3 lots of medicines per day. Mm-hmm. And what are the difficulties in these medicines for children from poor families?
Yeah, of course, the one thing you mentioned already, because many of the children have to take, especially when they're small, they have to take the medication as a liquid. So the liquid has to be mixed at home, so you have to have clean water. Otherwise, if you don't have access to clean water at your house, you have to buy clean water or distilled water at the pharmacy, which is definitely expensive. And the second thing is that the liquid has to be stored in the fridge, whereas tablets you can store at room temperature. So meaning if you have a child on liquid ARV treatment, it's much more complicated to arrange for all the setups you need for that. And then of course you have also have to adapt the medication a lot. So it's coming up with a lot of changes within the whole period of treatment, which you always have to teach also the parents about that and all these kind of things. But I think the main thing is really that the medication is often also not prepared in the way that the child could properly take the medication. I think with some of the medication it's fine because you have it as a liquid, but there are also other medication which you only can get as capsules or tablets, and sometimes they are just too big to swallow those tablets. But it's getting better, so I think the pharmacy companies, they're coming up with more preparations to get it adapted to the child. But of course that is always depending with more costs, because this is maybe more costly to develop those medications.